Hello everyone. In this video, we will talk about the fungal infection sporotrichosis. Sporotrichosis is a subcutaneous mycosis, but it can involve the cutaneous, subcutaneous and the lymphatic tissue. The causative organism is SPOROTRICHOSIS. Now this is a dimorphic fungus which exists in both forms, the yeast form as well as the mold form. The infection can happen in anyone, but the most commonly involved people are rose gardeners, forest workers or manual laborers. So people who are exposed to some sort of vegetation are most commonly involved. However, it can happen in anyone. In the clinical features, there will be a history of prick from a thorn. So there will be a rose thorn or any thorn from a vegetation. There will be a history of prick from a thorn, and the patient will develop nodules. The nodules will develop, which will later undergo ulceration, and from ulceration it will go on to necrosis. So this is the order that is followed, from nodules to ulceration to necrosis, and this process happens along the lymphatics. The lymphatic channels are involved, and since the lymphatic channels are involved, the lymphatics will become hardened and it can go up to lymph nodes and cause swollen lymph nodes. A disseminated infection would involve the bones, joints and meninges as well. So these are the clinical features: nodules, ulceration and necrosis, which happen along the lymphatic lines. Along with that, the lymphatics also become hardened and lymph nodes are swollen, and it also extends to the bones, joints and meninges. The specimen taken is by aspiration of nodules, and when we do a microscopy, we will see yeast forms which are cigar shaped. So this is the characteristic shape. They will be cigar shaped. And we will also see something called asteroid bodies, which are formed due to splendor Hepli phenomenon. Now, how do we explain this? So what it is that actually there's an organism in the center which gets surrounded by eosinophilic material. So there will be an organism in the center, and due to inflammation, due to deposition of antigen-antibody complexes, due to debris and fibrin, due to a deposition of all of this, the organism gets surrounded by eosinophilic pinkish material which forms radiating spokes like that of a star. That is why we call this an asteroid body, and the phenomenon of formation of this asteroid body is called splendor Hepli phenomenon. So these are the appearances that we have on microscopy: cigar-shaped yeast forms, asteroid bodies formed due to splendor Hepli phenomenon, which have an organism in the center, and eosinophilic material radiating on the periphery, which gives it a star-like appearance. When we do a culture and we take a microscopy from those colonies, we will see a characteristic rosette appearance. So the organism appears rosette shaped. In the treatment, we have itraconazole for lymphocutaneous disease and amphotericin B for a disseminated disease.